Hey everybody, welcome back to the Branson Show. My name is Dane Braden, and today I am joined by Lisa Marshall, the Director of the Taney County Health Department. So, hi Lisa, how are you?
Hey, I'm good. Thanks, Dane.
Good. So she did not come into the studio today. We're doing this interview remotely so that we can all do our part to help flatten the curve and keep safe distances between our neighbors. Now, as you can imagine, someone in Lisa's position has been very, very busy over the last couple months. Um, so we are very grateful that you would take time out of your busy schedule to talk with us and to address the good citizens of this community. So, and another thing that you viewers don't know is that she spent way more time than she planned on working with us because of the amount of technical difficulties we had just to get to where we are now. But thank God everything's up and running. Lisa's with us, and she's ready to bring us up to speed and answer some questions. So let's just dive right into it. Lisa, are you ready?
Sure, and thanks for the virtual opportunity. I do appreciate that.
Well, we're happy to have you. So, I guess let's start. Let's maybe do a recap over the last 72 hours. So I believe like Monday morning, we had our first confirmed case of COVID-19 in Taney County. Is that correct?
That is correct. So basically, we got the phone call pretty early Monday morning that said we did have one confirmed case in Taney County. We know that this was a travel associated case. So basically, somebody traveled outside of our area, they came back. And really, the thing that we're relieved about is that really this was a best case scenario for our community. So we, for the last, I would say, about week, have really been pushing messages recommending people coming back to our area to self quarantine for 14 days.
Mm-hmm.
And this is an example of where that worked very well. The individual returned back to our community and basically went into a self quarantine. They were not feeling ill at the time they returned to our community, but thank goodness they did do that quarantine piece because they later developed symptoms. So,
Wow.
to our knowledge, they've not been out in the community. They've not been to grocery stores or shopping or anything along those lines. And so, really, it is a best case scenario because we can say the risk of exposure in the community is pretty low.
Well, that's fantastic, and that actually answered a few of my follow-up questions because of course, people are going to ask, well, what's the contagion or the contamination concern with this case? But that's great. So, this is a prime example of somebody taking personal responsibility and
Mhm.
doing this self-quarantining, whether or not it was mandated by their local or federal government.
Absolutely.
They recognized the seriousness of the situation. They took matters into their own hands, and thank God that they did. I think that's encouraging. Like you
Yeah,
said, best
absolutely.
case scenario. That's awesome.
Yeah. Yeah, it's unfortunate that we do have one case here, but really, for that to have happened here is really the best case scenario. And so I think you hit on a really important point, just that importance of we each have a responsibility here.
Yes.
So I know that that might sound drastic of just leaving the area and coming back, being quarantining at your home for 14 days. That may sound drastic, but we just cannot stress that enough. We have, our world is so connected. People are very transient in nature, and so we cannot stress the importance of being sure that you are following those recommendations specifically.
Yeah. Yeah, and I've said this many times, I'll say it again, but even if you're not concerned about yourself getting sick, you've got thousands of other people in this community that you need to think about.
Mm-hmm.
Um, now,
Absolutely.
now, do you and or the Taney County Health Department anticipate an increase in confirmed cases in the days and weeks to come in our community?
I think that's a hard question to answer, just to be very frank. Obviously, we're watching what's happening across the nation. And I think that, we're seeing those numbers increase. As of yesterday, Missouri had 255 cases confirmed.
Okay.
In Missouri specifically, we are seeing those numbers jump pretty quickly. However, I am very encouraged to see that our community, and especially our business community, is taking this incredibly serious, and they are taking precautions. And we're taking these precautions many times before people realize they're needed. And so the thing about outbreaks that I think is important to understand is that by the time you realize you've got an outbreak or a pandemic like this on your hands, it's too late. And so taking these measures and these precautionary measures proactively is what's going to help keep our community safe. And then help slow that spread and hopefully decrease our numbers. And you've heard, I'm sure, flatten the curve.
Yes.
That's what we're going for here. And so some of these, recommendations and guidance may seem kind of extreme, but ultimately, the more we do now in slowing that spread of transmission, the better off we're going to be in the end.
I completely agree, and I think it's important what you said about when you reach a state of pandemic or crisis, it's already too late. Now that's not meant to cause fear or panic. It's just simply stating the facts. Once it reaches that level, we're already in it. So the best thing that we can do is, well, to do everything we know that we can to help prevent that spread.
Yeah.
I would, this is speculation, I would imagine that, the number of confirmed cases, that in order to confirm a case, we need testing kits, right? So there could be people that have it or are a carrier. They don't show symptoms, have not been tested. So we could, of course, have more cases than what have been confirmed. But again, this goes right back to doing your part, being responsible, social distancing, self-isolation, whatever it may be.
And something that I've told my staff now for a couple of weeks, and that I encourage everybody to just be in the mindset of acting as if it was already here.
Yes.
And so we've been taking those precautions for a couple of weeks now, just because, like I said, by the time you find it, those precautions needed to happen before you found it in the community. So we're certainly encouraging people to just keep up with that good hand hygiene. I don't like the word social distancing because it's important that we're social, just not being physically in the same spaces as today's evidence of that. But being sure that we're keeping those 6 feet and just really being mindful of how we're getting out in the community and how we're moving about. Because the less we can, or the more we can restrict our movements as a community, the lower our cases are going to be. So just really encouraging everybody, every single one of us plays a part in this, whether or not we're high risk or not.
That's absolutely right. We're all in this thing together. Whether or not you choose to view it that way, the truth is the truth. Now, in visiting this morning, Lisa and I were talking just a little bit in the midst of all the technical difficulties that we had to get ironed out. But she said something that I thought was very interesting and encouraging, and so I was hoping maybe you could elaborate for our viewers.
Sure.
But I said, I'm sure that this has just been a crazy busy week for you. And she said, yes, it has been busy, but it's really been a very busy couple of months leading up to this. And because of the way that I understood it was because of the preparation being done over the last 2 months, that when this confirmed case hit, it was not nearly as bad as it could have been. So could you explain what you and your department have been doing, ramping up and preparing for this, and how you're staying on top of these developments, just to let our community members know what you're doing behind the scenes?
Sure. So at Taney County Health Department, we started really monitoring this back in January. So we were keeping a close eye on it, kind of following what was happening internationally, kind of seeing how it was traveling and being spread. And then we really got very, very serious about this, I would say mid to late January. So we started meeting internally as a team once a week. And so that team came together, started talking about, what's currently happening, what do we think is going to happen, what's the worst case scenario. We like to plan for that and then hope for the best. So that's something that we've spent a lot of time talking about, just so that we are prepared. All along, we have been planning, and of course, I don't want this to sound extreme, but we just have been planning for when it happens, so that we would not be caught off guard at any point in time. So our team meets met weekly up until about 2 weeks ago. I think that was 2 weeks ago. A lot's happened. And then we started meeting every single day. So our team
Wow.
meets every morning and just touches base on, hey, here's what's happened over the last 24 hours. Here's what's coming up. Here's what everybody needs to know. And here's our to-do list for the day so we can be prepared for tomorrow. So that includes, all of our community education, which has been a huge piece of this, and making sure the community knows what's going on and can make informed decisions and is educated on the risk factors and what they need to be doing personally.
Yes.
So alongside that, we've also probably back, I'd say early February, started meeting with some of our community partners. We've got a task force that meets weekly. And so that consists of a lot of our healthcare partners, our first responders, our emergency management, basically anybody that plays a role in keeping our community and healthy and safe is a part of that task force. And we've been doing the same thing, kind of looking at, okay, where are we sitting? What do we need to be planning for? What do we as a community need to be working on? And then who's going to do what? And how do we communicate that out to the community?
Yes.
So that has been going on since February, early February. So between the two of those, when we did get our confirmed positive, we have been planning for months now. And so my team just sprung into action. We knew exactly what we needed to do. We knew exactly who we needed to call. We knew exactly what needed to be said to who. And then our team just jumped into it. So it's been very busy, but definitely we were prepared for this.
Well, that's excellent. That's what you want to hear from your local officials. We've been
Yeah, we were
preparing,
ready.
we saw it coming, and we were ready
Mhm.
when it hit.
Yeah.
Now that does lead me to ask, and I know we have other people curious about this as well. From our understanding, there is, I don't want to say a shortage, but maybe a limited amount of testing kits available. Do we have testing kits here in Taney County or testing stations, locations? Or
Yes, we do. So the thing I want to just point out, I think that's important to understand is that, this is a new virus. So that required, a new figuring out how we needed to test for it, how we needed to run those tests and what those processes look like. So I think it did take a little bit of time to get all of that ironed out just nationally. And so we now have more testing options available than we did. So we've had state health department test kits for over a month now at the Taney County Health Department. However, in order to use one of those, you do have to meet some certain criteria through our state health department.
sure,
Um, we've also had private testing available, so using labs like Quest and LabCorp to process tests for us, and so that's typically what's happening, in your healthcare settings, is using those largely. So just this last Monday, we actually launched a mobile testing site. And so that's been a partnership with all of our local healthcare providers, the city of Branson, and ourselves. So basically, you do have to have a doctor's order. So if you don't have a doctor's order and you've not been referred by your physician, then you won't be allowed to enter. So, we do have more tests that are available now.
excellent.
And I think one of the things I do want to just make sure our community is aware of is that we certainly want to test everybody that needs to be tested.
Yes,
But because these are, I don't want to say they're limited resources, but people that don't need to be tested, like we don't need to be testing folks that are not showing symptoms, that have not been had potential exposures, that are not in one of those groups that we're really concerned about. We've had some calls where people want us to just test everybody and anybody, but from a medical standpoint, that doesn't always make most sense, and it's not always the best use of what we have.
yeah,
So we can get more tests, but we want to be sure that we're using those wisely and
absolutely,
in an appropriate way.
absolutely. And I'm glad to hear that.
Mm-hmm.
Um, Now, you had just previously mentioned, certain people are more at risk than
Mm-hmm.
others. So I'm going to expand to a global level and then bring it right back
Mm-hmm.
down to our local community.
Sure.
So Italy has been ravaged by this virus with an ever increasing death toll. Some of the
Yeah.
sources are saying that this may be because Italy's population consists of a significantly higher amount of elderly people. So,
hmm
that being said, do we know the age demographics of people in Branson and or the Taney County area?
So what I would say in that regards is that even though not everybody falls in that 60 plus, which is what's considered to be high risk, along with chronic conditions and things of that
Mm-hmm.
nature. What we're finding in Missouri is that the second largest case numbers are coming from individuals that are 20 to 29. So that was
Wow.
actually something that was kind of surprising to come out.
Yeah.
So I think it's important to say that, even though we may have a larger population of those of that age group, really we're all being impacted by it. And so that's the more important point is that, that age group 20 to 29 is being hit pretty hard. But also, we all know somebody that falls in either the 60 plus or has a chronic condition. So we're all impacted by people of that age range. So it's so important that we're all being careful about slowing the spread and taking proper precautions.
Absolutely. And this is a prime example of why education is so important. Because from the get go, I think many people, including myself at one point in time, thought this was primarily an older person's disease.
Mm-hmm.
But clearly, that is not the case. And it's interesting to learn that in Missouri, you said 20 to 29 was
Absolutely.
the highest.
Second, yep, second highest impacted
Gotcha.
as far as our case counts go. So we're seeing that that age group is having next to the 60 plus is having the second largest numbers as far as cases go.
Okay. Now, have there been any recent developments in effective treatments for this virus?
So at this point in time, like I said, it's a new virus and things, there's still treatments that are being tested. So it does take a little while for that to be run through to make sure that whatever treatments we have are safe and effective and don't have, bad side effects that we need to be aware of. And so at this point in time, a lot of the treatment is done at home. So it includes things like rest and hydration. So kind of your take care of yourself at home sort of treatments. Of course, we do see some folks that end up in a hospital setting, and that requires more clinical care than the average.
Yeah.
Mhm.
Do you have dietary recommendations for people that want to, not necessarily people that are infected, but people that want to help boost their immunity? I guess is what I'm getting at.
Sure. So that's a new one. I've not been asked that yet, but luckily I'm a registered dietitian. Little known fact.
Awesome.
So basically, what we would encourage people right now is just, focusing on self care. So getting good sleep. Be sure that you're being physically active, trying to keep your stress level to a manageable level.
Yes.
That's a big one right now for a lot of us. And
Right.
so, and then also eating well. So plenty of fruit and vegetables. At our office, I will tell you, there's been a little extra candy floating around. But trying to be sensible about your food choices.
Yes.
So just good overall caring for your health and caring for your body, so that if you do come in contact with virus, that you can fight that off.
Yeah. Yeah.
Mhm.
Now, earlier in this conversation, you had mentioned not only our community of citizens, but also our local business community. Um, do you feel at this point in time that enough is being done in our community to help flatten the curve?
So I think that's a really good question. Obviously, we want to be more proactive than not.
Yes.
Like I said, we don't want to be caught in a situation where we just have an explosion of cases. So I have been very encouraged. I mean, even back in early February, we had businesses calling us saying, "Hey, would you review our safety plan?" Or "Hey, would you review just kind of what we're thinking we're going to do?" And so I have been really, really encouraged by our businesses. They've been very, very proactive. They have been very concerned about the well-being of our residents and our visitors at that point in time. Obviously, it's a different conversation now, but also very concerned about their staff. And so I've been really impressed by that. I've also been impressed by our city officials, and this is across the county, and our county officials as well. They have, it would be easy to say, oh, this is no big deal. It's just a minor cold that only really impacts people over 60. I mean, it's easy to say that, but our officials have really not taken that stance, and they've been pretty aggressive and proactive in looking at what do we need to do to protect our community. I do think that there's probably some additional measures that are probably, I would say, coming down the line. So I know we've just seen that Springfield Green, they just had an ordinance that came out, an additional proclamation restricting non-essential businesses. Branson has done something similar. So I think that's probably where we're moving. And obviously, we know that these are very tough decisions, and they're not decisions that anybody takes lightly or even really wants to make, quite honestly.
Right.
But if we can slow this spread and prevent us from having a huge outbreak that taxes our healthcare system, we're going to be in a better position to bounce back and to recover. And so those are some things that I think are probably coming down the line. And of course, we're watching what happens in other states because we want to be sure that we're not one of those hot spots that they're talking about on the news.
Yeah, absolutely. And that's encouraging to hear that you had local businesses reaching out to you as early as the beginning of February.
Absolutely.
That's fantastic. So they're looking out for, the local people in the community, people visiting our community because it is such a tourist-based town, and then looking out for their own staff as well. Now, my co-host, Ginger Michaud, publisher for Parade of Homes Real Estate Magazine, she was not able to join us this morning, but she did have a great question that she's been researching, but she can't seem to find like a consistent answer on this. But as far as ways that the virus is being transmitted, do we know how long it can survive on like a surface or in the air, things of that nature, so that we can better prepare, clean, avoid, whatever it may be? Do we have more exact numbers on those types of things?
I have seen a lot of different numbers, and I don't know that there has been a definitive study that shows those numbers. I know I've seen that somebody said there was so many hours on a cardboard box versus on copper versus on this or that. And so I would just encourage everybody, we don't have those numbers, solid numbers just yet, but just disinfection regardless is huge. And so being sure that you're using, cleaners that are effective against the COVID-19 virus, and then being sure that you're disinfecting areas often, especially areas that are heavy traffic and heavy use. So I think because so many businesses do fall into that non-essential where they're no longer inviting the public in their doors. I think that is going to really help slow the spread because we're not touching as many doorknobs, we're not touching as many handrails, we're not using as many pens out and about and leaving them on the counter. Yeah. So those are things that are all going to help slow this spread. But I would just encourage everybody, good disinfection is also what's going to help slow this spread. So keep that up.
Yeah, absolutely. Now, maybe this is overkill, maybe not. I would be interested to hear your take on it. But when I go out and when the other members of our team and our staff go out in public, typically if we're going out, it's because we need to buy food. But when we do so, we're wearing masks and we're wearing gloves. And it's not so much that we're concerned about getting it, although it is interesting to learn that the second highest age group is 20 to 29. But if I was a carrier and didn't have symptoms, I would not be able to live with myself if I were to pass it on to someone's grandfather or grandmother and, God forbid they succumb to it. So every time we go out, we're wearing gloves and we're wearing masks. Just to try and do what we can to curb it. Now, we do get some interesting looks while we're out and about, but is that something that is wise for other citizens to do, or are we taking it a little too far? What do you think?
So here's my honest take on that. So at this point in time, the CDC, the State Health Department, do not recommend wearing gloves and masks when going out. And so Unless you are, obviously, if you have the virus, we want you to stay home. But if for some reason you had to get out, please, please, please wear a mask, and please, please, please do not get out if you have the virus. That's what we're begging people. But really, the other struggle we're finding is that for healthcare providers, for first responders, we cannot get a hold of those supplies that we need, as many as we need, because they've been bought up by the general public. And so it is not recommended actually to wear those out in general public unless, if you had like a cold or something like that and wanted to curb spread of that virus, sure. But just for general use, it's not really recommended. And the other thing that we're hoping is that, with these urging people to stay home and the non-essential businesses not being open to the public, we're really hoping that people take that seriously and stay home and only get out for those necessities. Because like I said, the less we all move around, the better off we're going to be.
Absolutely. And on that note, let me back up for just a second. For clarity here, the masks, is it the N95 is the medical mask that is so sought after right now?
Basically, any masks are sought after.
Okay.
So, yeah. So, like for example, if you went to your doctor's office and you had a cough, they would give you just a regular surgical mask, and that's because coughs can be they can spread droplets, and viruses can live in droplets. So, if you had a cough, you would be asked to put one on.
Mm-hmm.
And so, when we start depleting those sorts of supplies, where we can't slow just viruses in general, then that's when we really get in a problem.
And I have no idea if this is going to spark a change of heart or not, but let's say someone did stock up on masks. Let's say they have some unopened packages. Could those be donated to local healthcare providers?
Absolutely. I will tell you that there are groups that are looking for those right now. So basically your health departments, your hospital settings, people don't always think about your first responders. So believe it or not, but police officers need those. I mean, they're out responding and talking to all kinds of people. Your fire department, they need those as well. They respond to medical calls. Obviously your ambulance district. So there's a whole slew of people that need those masks that are having trouble getting them, like long-term care facilities, so nursing homes, assisted living situations. Anybody that's going to be out and about in contact with people that are at a higher risk or that are responding to medical calls or are just out a lot in the general public in that emergency capacity are at a higher risk.
Absolutely. So for those of you watching, listening, tuning in, if you do have medical masks, let's try and get as many of those as possible to the people that truly need them, the people on the front lines, the people that are fighting to keep our communities safe and healthy. We don't need to keep buying Walmart out of everything that they have. Let's think about the other people in our community as well. I think we have pretty much covered the most important questions and pertinent issues that we've been receiving from our viewers. I really appreciate you taking the time to come on the show today, and I want to kind of turn it over to you. I want to give you the floor, give you this platform, and give you an opportunity, to ask of the citizens, what you would ask of them, to educate them on what you want to educate them on. What would you say to the citizens of this community, and how can we all help do our part to flatten the curve and beat this virus together?
So there's a couple of things that I just cannot stress enough. That piece about if you have left our community and come back, so if you've gone, to another community for whatever reason and come back, we recommend and we strongly urge you to self-quarantine for 14 days. Okay. Now, an important piece of that is to know that a quarantine is for someone that's healthy. So that is not for somebody that is sick. So quarantines are used as a precaution, and they're used just in case somebody does come down with something. For example, the first COVID case that we did have, And so that is what we're asking people to do, because that's a good example. Our first confirmed case basically protected our community by staying home. And so we are just asking people that that's a good example of how it worked right and how
Yeah.
it worked well. But we cannot stress that enough. If you're coming back to our area, please self quarantine for 14 days. Then the other piece that we are just cannot stress enough is that every single person in our community plays a part in this. This is not just my job or the hospital's job or somebody else's job. This every single person plays a part. So every time you are going out into the community for something that is non-essential, you're putting yourself and others at risk of exposure. And so we just can't stress that enough. Like, please stay home unless you're out for essential items, such as food and medication, those sorts of things. But we all play a part in this, and I can't stress that enough.
Yeah, absolutely. And I know that the Taney County Health Department has been very diligent and very proactive on staying on top of this, making sure they have the latest, most up-to-date information. And I know that one of your missions is to help keep the public informed and educated and up to speed. And so I know that you guys have, of course, a website, some social media pages. So could you tell us, for people that are wanting to stay up to date on
Mm-hmm.
the latest COVID-19 information
Sure.
and what they can do or not do,
Yeah.
where can they find you and your department's updates and things of that nature?
Okay. We have a website. It's taneycohealth.org.
Okay.
And on our homepage, there's a little drop down bar that says, I think it says something along the lines of, for the latest COVID-19 updates, click here. And then it takes you to a page. We have a little graphic on the top that basically has a count going. So it'll say how many cases we have confirmed, I think we've got now how many have been tested, and then what's the state total. So we've got just some good information there that is frequently asked of us.
Yeah.
And then below that are several links to good resources. So we keep getting questions, and they're great questions about, how do I disinfect? What should I be using? Do you have guidance for like childcare providers? Do you have guidance for this or that? And so as much information as we can push out there, we've been putting on our website. We also have a Facebook page.
Mm-hmm.
And so that is something that we update daily, if not more frequently. We put all of our press releases on the Facebook page. We basically just copy and paste them in full text. That's not the most visually appealing format, but it gets the information out there, right? So we do public health well. I'm just going to say that we're not media specialists. Basically, that all of our press releases, any new guidance, or any like frequently asked questions or hot button issues that are coming up, we post there. We recently started doing, I'm hesitant to say this, but we've recently started doing a little minute-ish long snippet with me, just talking about, hey, here's an update for the day. So people seem to be liking that. We'll continue it as long as people like that, and as long as it's pertinent. So those are some things we're doing to really push messaging out in the community.
That is awesome. And for those of you watching, we will do our best to plug all of those resources in the post when we release this interview, which should be going out later today.
Good deal.
Lisa, thank you so much for your time. Please thank your department as well on behalf of us and everybody in the Taney County community. I really appreciate your information and your insights today. And I just appreciate you taking the time to speak with me and address the public.
Absolutely. Well, I appreciate the opportunity, and thank you again for taking this as seriously as it needs to be, and giving us the platform to help share the message. So thank you.
Absolutely. Well, you guys have a great day, and we will be staying tuned to your channel quite frequently.
Thank you. You guys have a good one.
Thank you. You too.